Thank you for taking time from your busy day to watch this special presentation from the El Paso County Medical Society. I'm Dr. Joel Hendricks, President of the El Paso County Medical Society, and it is my hope that you will find our program of great interest, educational, and informative about the medical care provided by some of our best physicians in our country, right here in the borderland. From all of us at the El Paso County Medical Society, please enjoy tonight's program.
Vaccines, it's always a hot topic and still is. With COVID vaccines taking most of the media attention over the last several years, the focus has been steered away from other vaccines that are very important for everyday life for both children and for adults. Vaccines, Defend What Matters, that's the name of the program. This program is underwritten by the Texas Medical Association as well as the Texas Medical Association Foundation and UMC University Medical Center. And also a big thank you, as always, to the El Paso County Medical Society for bringing this program to you. Enjoy this episode. Hello, we have a special program today. It's all about vaccines, but we're going to kind of chop it up in a couple of different pieces here. We have Dr. Joel Hendricks with us, who is the Chief Medical Officer for the University Medical Center. He's also serving this year as the President of the El Paso County Medical Society. And you started out as an OBGYN. You have so much background to you. So you have some very specific vaccines that we're going to talk about, and then we're going to move to a couple of other doctors that have other vaccines to talk about. So vaccines, vaccines, vaccines. Why are they in existence, and why are they so important?
Thank you, Catherine. And first of all, I'd like to take this opportunity to thank you for your 26 years of doing this show.
Oh.
This is a important medical education for our community, and you've been a part of that. And
Thank you.
You have teased out from physicians what is important, and we appreciate that.
I appreciate you saying that, really.
As the president of the El Paso County Medical Society, I want to thank you personally for that.
That makes me feel like $1 million. Thank you so much. I love doing this show. I learn so much. I learn when to panic, and I learn when to calm down. It's going to be fine.
That's
so
great.
I appreciate you saying that.
It's great.
Give us a background on you. I know we were talking about vaccines tonight, but for those people, I feel like everybody knows you, but maybe there's someone tuned in that doesn't know you. Give us a small background on who you are in the medical world.
Well, I was in private practice for over 26 years. And certainly as an obstetrician gynecologist, it was my pleasure to experience the miracle of birth and being able, the privilege of taking care of families, and not just women, but families, because the family unit was a part of that experience. And then 6 years ago, transitioned over to the Chief Medical Officer role at University Medical Center. It's been a fabulous experience, and I've really enjoyed it. And certainly I appreciate the association with the El Paso County Medical Society and being able to work with all the smart individuals, not only in the El Paso County Medical Society, but in our community. And
we have a great community when it comes to medical. And a lot of it, I mentioned COVID in the opening just a little bit, because there was really the coming together of all different medical sources in this community. And I was so proud about El Paso. When you hear about other communities not quite getting their act together, we had our act together. And UMC was a huge part of that. All the hospitals came together.
All the hospitals.
And those were vaccines we're talking about. And I know we're talking about other vaccines right now, because I feel like the COVID vaccine really has had its shiny day, and it's still around, which is great. But I'd like to focus a little bit on the vaccines that you would like to talk about this evening. And Gardasil is like the one that is screaming, because there's been more recommendations and changes around Gardasil, I feel like, than a lot of other vaccines. And if you can kind of head into that as to why we have vaccines in the first place.
Well, I think to your point, the vaccine, why do we have vaccines? I mean, vaccines have been with us for well over 100 years, and millions of people have gone through vaccines. And so certainly there's a political aspect to the vaccine that we see today. But the reality is that vaccines help prevent serious illness, and that they have saved so many individuals. Not too long ago, polio was a big problem. Now with the polio vaccine, we have that ability to mitigate against serious effects from polio. And this is transitioning into modern vaccines, and that we have different methods of vaccines coming to how they work within the body. So the question is, what do they do?
Right.
What is it about a vaccine? I mean, and I think the part of that is the idea that it stimulates your body. It helps you fight off disease. It helps you not get so sick in many cases. That's very important. An ounce of prevention is worth a pound of cure.
Right.
And so these are very important from a population health, from an individual health. And each vaccine, as we learn more about how we deliver the vaccine, then we're able to get it with less side effects, potentially. And in medicine, we as physicians have to use a risk benefit. So anything that we recommend, we have to say, here's the risks, here's the benefits, let's talk about it.
Right.
Let's see if this is what we agree to. And with that, in many cases, we would only recommend what we think would be of a bigger benefit than the risk.
Right.
And nothing is perfect, but having said that, we have been so successful in population health and keeping our society healthy in many ways because of vaccines. And I think tonight you're going to hear from the other physicians about those successes and specific ones that as we move forward.
Exactly. And we were talking about earlier, just when you're talking about risk benefit, and I know that you wanted to touch base on, again, as an OBGYN, there are some vaccines that if you're pregnant, you might want to either wait or steer away from a while, but I do want to touch base on that because there's always the questions. And again, not to get political, people, it's not to have them. Maybe it's not the best time just right now. And I'd love for you to touch base on that.
Well, I think, as an OB-GYN, over the course of my professional career, we've seen a little bit of change in, for example, in pregnancy. So vaccines were not as important or emphasized early in my career. But as we got further along, we realized, they're not causing the issues that we want. They are preventing preterm birth. They are preventing some problems that are a benefit. So, for example, when you look at Tdap, tetanus, diphtheria, that you will have as a recommendation between 27 and 34 weeks to get it in every pregnancy, even if you've had it before. You look at the flu vaccine.
Right.
So we think that the flu can affect pregnancy in a way because of the respiratory problems that can occur. And it's recommended every pregnancy that you go ahead and get the flu vaccine. So these are vaccines that we didn't necessarily recommend before. And then now we have the COVID. And so COVID vaccine is a new method of delivery, and it's better, and it has less side effects, and it helps prevent early delivery. It helps prevent ICU stays. It helps prevent stillbirth and preterm delivery. So these are three vaccines that we feel very strong would benefit. It's a discussion with your provider.
Bingo.
You've got to talk to your provider. You've got to ask them the questions that you have, information that you may have received off of social media, and understand what that is to see if that's something right for you.
Exactly. And like you said, have that discussion with your doctor.
Yes, that's very important.
So I do want to circle back around to the HPV vaccines and Gardasil, because I know that Gardasil 9 is relatively new. And if we can kind of quickly go through 2 doses, 3 doses, and I know it's 15 and younger, that we do want to, ideally, children, before they start having sex, to be very blunt about it, that would be the ideal time to have both of these vaccinations done. So it's a series of vaccinations. So let's talk about prior to 15, over to 15, and just in general, how you would tackle that when parents ask you these questions.
So I think that, when you look at Gardasil started only for females, right? And it was to prevent some cervical change is what they were looking at. And it seemed to be effective. And they found that the earlier, the better, to your point, before relations are started. Having said that, as they've done more studies and have they researched it, they found that men benefit from it, and that you find that the Gardasil 9 versus the early Gardasil was about, Gardasil was 4 variants. Now the Gardasil 9 has 9 variants. So it covers a wider range of the human papillomavirus, which is a benefit. So when you talk about 15-year-olds and younger, so that's a 2-dose regimen normally, and it's 6 to a year apart. So you spread it out. You don't overload that system. You let it happen. And then anything over 15, then it's a 3-dose system. And it's usually 4 to 6 months, and then you go wait again to have your 3rd dose. And you can wait if it's a year or so. You don't have to start the series over. You go ahead and get it done.
So the nice thing is if you have 2 before the age of 15, it's not like you're going to need the 3rd one after the age of 15.
Correct.
So 2 really does protect you under the age of 15. It helps out with that whole immune system.
Understand
Yes.
that Gardasil does not prevent sexually transmitted diseases.
Correct.
Period.
Right.
It does not say you will not get the virus. What it does do is it helps prevent changes leading to cancer. Cancer can be in the cervix. Cancer can be in the throat. Cancer can be in the rectum.
And so it is just, again, you said earlier, and I just want to make this clear, because a lot of people, as was I when I have a 26-year-old and a 20-year-old now, and when they were pre-teens, this came out, and I thought, okay, well, my son too. And it was just at the point where, well, you have a son, he needs to get this too. And I remember thinking, but he's a boy. So I'm glad that you brought this up. And again, when we're looking at the different strains of the virus, it's not just cervical cancer.
Correct.
So I wanted to bring that back up too. And I know that we're about to switch over to the other docs. Is there anything that we haven't talked about with you that you want to bring up before we switch over to the other doctors that are going to be here? They're going to kick you out. Isn't that sad?
Thank you very much for the opportunity. It's been a pleasure.
It always is.
As once again, I think doctor-patient relationships are very important. And being a little bit prepared when you go talk to your doctor with questions that you have, and trying to get the answers that you feel comfortable with in your care, whether it's vaccines or antibiotics or anything, because everything has a risk and benefit. And if you understand that, then that helps your body heal better.
Exactly. And I do want to give a nice another plug here for the El Paso County Medical Society. And Dr. Hendricks, as the president this year, we've kind of implemented this. You can still ask questions. I know that we're hearing this back and it's not a live program anymore. However, if you do have questions about any kind of vaccines, feel free to email info@EPCMS, which is the El Paso County Medical Society. So info@EPCMS.com, and we will get those questions answered either to you directly with that email, or we can answer the questions the next time we come on the air and say, hey, last month we had this topic, and we're going to answer those questions. So Dr. Hendricks, thank you so much for being here. And you're watching the El Paso Physician. Stay tuned. Thanks again for joining us. We are talking about vaccines, defend what matters. And we have 3 additional doctors here with us. We have Dr. Allison Days, who is the editor of the El Paso Physician magazine, which is hard work. And the El Paso County Medical Society says thank you for that, because there's a lot of stuff that you have to proof every single month. And then it goes in every 3 months. And you're also the medical director at Healthy Days Pediatrics with UMC. So thank you very much. We have Dr. Roxanne Tyrock, who is with IntelliMedicine, PA, and she's also a Texas delegate to the American Medical Association. So you guys have a lot of big things going on here. And then we have the mucho muy importante dude with the City County Health Authority, and you are the public authority on everything vaccines. Right. And a lot of other things too. But for today's purposes, that's who you are. So you're tuning back in. We just had Dr. Joel Hendricks on as well, that kind of gave us a background of why vaccines. Why are there vaccines in this world? And so there are so many questions. We were talking about Gardasil for a little bit and the human papillomavirus vaccine and children. And so there are 2 pediatricians on the board. Both of you all are pediatricians. So when you're looking at vaccines in children, give us a little bit of background on why you do what you do, Dr. Days.
Why I do what I do. Well, first of all, I didn't mention this in the intro, but I actually also have a public health degree. And so being both a public health person and a pediatrician, as Dr. Ockerenza also is, I think vaccines are sort of at the forefront of that. I think definitely in United States history and maybe even world history, I think the vaccine is literally probably the second most important public health success that we've had. And it starts in infancy. I mean, the immune system is first developing in infancy and shortly after. And so we're also kind of encountering many new things every day as children, many new viruses, vaccines, and that's how our immune system develops. And it makes sense to sort of help that immune system as it's growing to contact the things it's supposed to that will help us and avoid the things that might kill you. You know, so that's sort of how I see vaccines as part of the growing process.
Exposure. Every time you learn something, what doesn't, was it something that doesn't kill you? What is it?
Yes. If something doesn't kill, it makes you stronger.
Gosh, maybe
whatever doesn't kill you makes you stronger.
Dear
exactly.
Lord.
I absolutely believe that in terms of vaccines. And I think, and when I approach it with families, with parents, I also always let them know that I personally fully believe in vaccines, and I vaccinated my children, my family's vaccinated, I'm vaccinated, so it's just, to let them know that it's okay and it's actually a good part of medicine and development and being part of the world.
Right, exactly. Exposure to anything makes it a little bit stronger. And Dr. Tyrock, on that note, we hear a lot of media attention around different vaccines. One of them, shingles vaccines. There's a lot of media around that. We don't have a lot of media on RSV, but I'd like to talk about that, especially in adults, because we talk about that a lot currently in the last year or so with children. But we haven't really transitioned a lot of media attention to that in adults. And I'm throwing them all your way, but I'm going to come back to a specific one, but just kind of giving it to the audience. There's pneumonia and flu and COVID. A lot of people see those kind of as the same type of ouchiness. When you get sick, is it pneumonia? Or is it something that's COVID and the flu that leads to pneumonia? We'll talk a little bit about those vaccines. Tetanus, that we never talk about. And you should have that every 10 years, and then all vaccines that adults need. But let's talk about the shingles virus first, because that I feel like media attention's been there for the last 6-7 years. Talk a little bit about the shingles vaccine virus and why people should get it.
Well, certainly. And I do have some graphics. They say that sometimes a picture speaks 1,000 words. And this graphic here, this is one of the most dreaded complications of shingles. Shingles can affect the face, it can affect the eye, which can then affect your vision. There are a lot of different side effects symptoms from shingles. The most common and well-known one is the rash that comes around on the thorax. There's itching. It's a blistering, painful rash. That's another dreaded complication, is even after the rash goes away, you may still have lingering pain in there. That's called post-herpetic neuralgia. And many people will have to take medications for long periods of time after they've already recovered from their shingles because they still have that pain. We've got headache, sensitivity to light. So we can prevent this. At the age of 50, all adults are recommended to receive their first shingles shot. And then there's a booster anywhere between 2 to 6 months after that first one. It's very important to remember to get that booster.
Nice. And sometimes there's these series, and we're going to talk a little bit about that too. And again, with COVID virus, we knew that you had one and then you had to get another one too. And so let's talk a little bit about tetanus shots. And we'll show some graphics in a moment when those are appropriate. But tetanus shots are usually given, in my experience anyway, that you had a bad accident and something was either rusty or it's like, what, have you had a tetanus shot? Oh my gosh, no, I haven't. So maybe talk about why that's important for people to just keep up on it. Maybe the general practitioners have that in their chart. And maybe since we, in this program, we're trying to teach prevention, we're trying to let people advocate for themselves to talk about their own tetanus shots.
Well, you're absolutely right that that is where most people think about getting a tetanus shot. And we should continue to think of that when you have a trauma, particularly a puncture wound, that you need to get a tetanus shot. Even if you had one 2-3 years ago, you still get another tetanus shot. So all adults, so your last childhood tetanus shot will be around 12, 13. I'll defer that to the experts here.
11 to 13.
And then 10 years after that, you start getting the adult every 10 years. You can get the TD, which is one shot that contains tetanus and diphtheria, or it's now considered acceptable to get a Tdap instead. That adds pertussis. And so that's something that people tend to forget about, and that's why we're talking about it here.
Right. Beautifully said. Now to the mucho muy importante, dude. I'm saying that with a very terrible German accent, and it's not coming out right.
But
Dr.
it
Ocaranza,
goes even better when you say it in German. I even feel more important now.
there you go. So we were talking right before we got on the air about the COVID vaccine, the flu vaccine, pneumonia vaccine. So we thought, and I know when you and I did a show together, I think last year, that eventually the COVID vaccine, the flu vaccine may become one. But right now we're still looking at COVID vaccine and flu vaccine being two separate vaccines. And I'd love for you to talk about the importance of maybe even getting both of those in tandem when it's that time, and how often people should get those. And I know it's loaded, and it's been changing a lot over the last 3 years. So again, thank you for being the health authority. We see you all the time thinking, okay, what's the latest today? Dr. Ocaranza, tell us.
And thank you for giving me the space to talk to the people about that. There's a lot of comments about vaccines, get it, not get it. Why we do recommend that? We in El Paso suffered tremendously from the loss of the loved ones. Why? Because we didn't have any medication, we didn't have the vaccine, and people were dying of COVID. That is the main reason why we still strongly recommend the COVID vaccine. And we're still going to continue recommending the COVID vaccine every fall. Now it's not going to be the flu season. Now it's going to be the COVID flu / pneumonia season.
Right.
And that's why we continue to tell the people exactly to get the COVID vaccine every fall, get the flu vaccine every fall. And we know that these respiratory viruses are going to be changing year after year. And the vaccine, as the virus changes, is going to continue changing, trying to protect us from the variants or the strains that are going to be circulating in the fall, winter, and spring. So that is the reason why we will continue sending that message out to the community. Please vaccinate. Please get your shots. We don't want to see you in the hospital. We love you, but we don't want to see you in the hospital.
We love it, but we don't want to see you here.
Yes.
So that's a great question, because I was thinking about the three. Are we at the point too now that RSV should be in every fall lineup, so to speak? So are we looking at, and pneumonia vaccines, that's another question. Do we recommend pneumonia vaccine for everybody? Dr. Tyrock's got her papers out. So anytime you want to jump in on a question, feel free to do that. So
Yes.
Is that something you want to explain or talk about?
Do you want to talk about kids or adults? I'm adult.
Let's first talk about adult.
Okay.
Because I think about RSV just myself right now in pediatrics, but I'm talking about adults going forward. Is RSVP something that we are recommending on a yearly basis, as well as the flu, as well as COVID for adults?
Are we, am I addressing RSV now, or am I addressing pneumonia now?
Let's do RSV.
RSV.
Yeah,
Okay.
because I figure that's the one people haven't really heard so much about.
Right. And the reason that we haven't heard about it is because it was just approved by the FDA in May. And then the CDC Advisory Committee on Immunization Practices met in June. For several days, they deliberated on the recommendations on this vaccine for adults. So the final verdict was that in individuals over the age of 60, that it's shared decision-making between the physician and the patient. And there are several reasons for that. There are particular underlying disorders that render an individual at increased risk for hospitalization and death. And those are coronary artery disease, emphysema, asthma, congestive heart failure in particular. Those are the ones that were studied, but there are many other disorders that fall into that category that we know, from the past RSV seasons, that such as lymphoma or transplant patients. So data is not available on those patients yet. So there are two on the market. The GlaxoSmithKline version is it's an agent that causes the immunity, and it's mixed with an adjuvant. And it's about 50% of the volume of the same adjuvant that GlaxoSmithKline put into the shingles shot. It's to RSV-A. The Pfizer version is a combination of the agent for RSV-A and RSV-B, and there is no adjuvant. So really, we cannot perform head-to-head studies on these two because they're really not the same. What we do know,
And you said this was first approved in May, so we're still relatively new in this
Very.
whole process. Okay.
it's not even really.
It's not even a study yet. Yeah. It's
Yes.
like we're seeing where this is going. So that's great. So if we're going to recommend at this time, the recommendation would be talk to your doctor to figure out if you're a person that would be good is in the trial, so to speak, but not a trial. So that's nicely put together. Dr. Days, I kind of brought it up earlier regarding, is it better to do vaccines separately or in a combination? And maybe we can look at that also as a pediatric doctor and then also moving into adults. So I know, again, 26 and 20 are the ages of my kids, but I remember that one appointment where you go in and they had 4 that they were going to get. And it was like, you're, biting their nails the entire week before that. Explain why that's the case. And again, the combination of separate or together.
Sure. Well, one of the things that I think a lot of parents and kids themselves or teenagers are very stressed about now when they go in the doctors is there are a lot of pediatric vaccines. There just are. If we look at the schedule, there are a lot. And that is a good thing because it means that we're finding more and more how to fight some of these diseases, how to protect against diseases. And many of these vaccines, before there were the vaccines, people would say, when they had people in the hospital dying, they would say, why don't we have a vaccine for this? The same way they did for COVID. And then we did. But now parents are saying, oh my God, when I go in, there's, as they look at 10 zillion different vaccines we need, and won't it overwhelm the immune system? And won't it really hurt my kid? And won't it do this and do that? So we spend a lot of time talking to them about this. Over time, there are a lot. So you don't want to have to give 10 different injections to a child at one visit, especially small kids, skinny kids that have not a lot of fat to put it in or not a lot of muscle. And so what they've done is they've created a lot of combination vaccines that combine some of the major ones you need and the ones you need multiple doses of.
Perfect.
So some of them would have like the Tdap, which we've talked about, a Hib, which is influenza bacteria, not the flu, but it's a bacteria. That can also cause pneumonia and things like that. And hepatitis B is another one that they would put in a combination. So there's a couple combination ones that combine different groupings of vaccines. And for us as doctors, I prefer the combo vaccines because it means that you're only giving, let's say you're giving 3 injections to a child, but you're really covering them for 7 or 8.
So is that becoming more and more commonplace? And when did that really start? I mean, is that something, it seems relatively new to me.
It's relatively, I want to say maybe 10 years ago, 10, about 10 years ago, I would say that they started really pushing the combination vaccines and being able to figure out how to put them all together in one injection. So that's come about relatively recent. Now, many parents are very excited about that, the same as I am. Oh, great, we don't have to do that many injections. My kid is not going to be in that many pain. But there are other parents who have now looked at it and said, yeah, but they're all at once. That means that it's going to, what they say, that's going to overwhelm their immune system. Realistically, most studies have shown there's sort of no such thing as overwhelming the immune system. I mean, our immune system is built, if you look at other countries, third world countries, where they face these things every day without vaccines, they're facing natural infection.
They should be overloaded, but they're not.
And so their immune system is actually facing this stuff all the time. And we're giving them a little teeny bit in these vaccines of the actual virus or bacteria, or not even, sometimes just a simulation of that tricks our immune system into creating antibodies. And so the antibodies get created to 3 the same way it would to 1. It's just, it's just doing multiple at the same time. So it really, that I think that reasoning is somewhat of a fallacy that people think.
That combination is great. I have to give a shout out to Dr. Nikki, your predecessor. And I remember the media campaign, 2, 4, and 6 months, El Paso, Juarez, and Las Cruces. Do you remember that? So it was talking about when the parents, like 2, 4, and 6 months, you have to get a vaccine each one of those months. And is that something that's still the case? Is that still a practice now? Is it still 2 months, 4 months, 6 months?
Pretty much,
Still the case. And we still see the children that they come for the wheelchair visit. And along with that, they get their shot. Teenagers come and the dreaded question, like, why every time we come to the office, I get a shot?
And I like to tell them sometimes, the next time you come, you don't need a shot for 3 years. Isn't that great? Except for maybe the flu, maybe the COVID. We still have to say those things.
You tricked me. You tricked me. Yeah, you put some kind of a bribe in there when it's time to go to the doctor. I remember that very much. Dr. Ocaranza, let's talk about, again, you're on the air a lot when anytime there is a communal type of happening regarding vaccines. So do you find that right now with the COVID vaccines, it was the shining star for a long time. Everybody talked about it constantly. And I feel like in the last year or so, we were just talking before this program too, the COVID variant vaccine came out in October. That was the last one. Is that correct?
In October, that's correct.
So what was, and you don't have to give me numbers, but just in general, the response from the public of receiving the COVID vaccine after October, was that lagged from the ones prior to because people weren't so worried anymore? Just give us what your background is and the team that you work with on people still being serious about it.
And initially, because we had that experience that we were the hottest spot in the nation about COVID, the initial response to the vaccine when it was rolled out, it was amazing. We were the first city to reach very high levels of people vaccinated. People wanted to get the vaccine, and they saw that receiving the vaccine was going to be the life-saving event, basically. But then as the time goes by, as people started getting sick with COVID and they saw, well, I didn't get sick that bad, so I guess I don't need it that much. So the response to the subsequent booster doses of the vaccine was not as great. And unfortunately, after October, the uptake of the vaccine was not the greatest, but definitely talk to your doctor, talk to that trusted individual that you entrust the care to tell you how effective it's going to be and how you're going to be benefiting from receiving the vaccine because of your particular medical condition. So public health, we can tell you as a blanket, yes, we recommend it for everybody. But if you want to know something that is going to be specifically to you, talk to your physician. That's going to be the one key thing that you need to do. And that is the reason why we need to continue having that trusted relationship with your physician so you can see why we continue to strongly recommend the vaccine. We hope that everybody gets it, everybody that is approved for it. And we need to continue doing that because, yes, we want to see you well and alive. And the vaccines are, as we told you before, a life-saving tool that we have in our big bag, like the old days. Like you said, Dr. Nicky used to carry his bag.
Oh, Dr. Nicky.
I know.
Yeah, I know. And Dr. Hendricks earlier had talked about risk and benefits. I'm really looking at benefits, so it really makes all the difference. Dr. Tyrock, we talked about some very specific vaccines, but there is a ton of other ones out there that we haven't touched base on. So I'm asking you to pick either the ones that come to your mind as a person who's a specialist in this field, like which other vaccines have we not talked about yet that you feel like need to be stressed to the general public?
Well, thank you so much for asking that question. The one that has changed recently is the pneumonia recommendations. And for quite some time, the recommendations have been that at the age of 65, a person of average risk that does not have high-risk conditions would get the Prevnar 13, and then about a year later, they would get the pneumococcal 23-valent vaccine.
A year later, did you say that?
Yes.
Okay, so you're looking at, is that a series then?
Well, that was the recommendation. So many people probably think that that's still the way it is, but there have been two new players on the market.
Okay.
And that is the 15-valent and the Prevnar 20. So it used to be simple decision making, and now it's more complex. For example, if you got this, then you would get that. Many people come into my office and they say, I was told that I'm good for life because I got the pneumonia shot. And really, we need to be looking at this as pneumonia vaccine science changes over time. And so you always want to check with your physician about what are the new recommendations. Have things changed? So it's really kind of complex right now. And also individuals that got the 7-valent way back when are now eligible to come back in and get vaccinated
describe way
again.
back when. Is that like 5 years ago, 10 years ago?
As
So
probably
just a
over
kind of
10
an
years ago
idea
with
of-
the 7.
Okay.
Mhm.
So when we're looking at that for pneumonia vaccine, and say someone did get a vaccine, and just like we were talking here, tetanus, I can't remember when the last time I had my tetanus shot, and I have to check that out. So just thinking of the normal average person's like, well, was it 10 years ago, 15 years ago? My question there is, when do you, so whoever your doctor is should have your shot chart, which is something that all of our kids, every time you go to school, you got to have your chart. So you can always check that chart. And I'm looking at Dr. Ocaranza because I'm thinking too, with the COVID vaccine, because we were getting vaccinated in a lot of great community areas, it really was up to the individual to bring our little card to our doctor and say, please put this in my shot record. So when we're looking at the normal population, how do vaccinations get tracked? Are they now just part of every computer system? And that's kind of like the the system we have now where everybody's medical records are uploaded, the FIX system.
Mm-hmm.
Is that kind of what's happening? Is that something that's becoming more and more normalized to where you really do know what vaccines you had? If you go to Walmart, for example, and get your vaccine.
It's
You hit a
so
really good
disorganized.
spot.
Yeah, because
Yeah,
they're all
actually,
over the place.
It
And
is.
that's,
It's
Yeah.
a good point. Yeah.
Eventually, we're going to be having some commonalities in the way that people need to sign, so people can share their medical records with other people.
Mhm.
In the same way, the states are going to be sharing the vaccine records with other states as people move. One thing that I want to make sure that we tell the parents, especially those that are going to go to college, that have kids that are going to go to college, take your shot record with you. Because you're an adult now, it doesn't mean that you're not going to be having shots. Now, like Dr. Tyrek said,
Mhm.
yes, you're not over.
Mhm.
So take your shot record with you, see what you're going to be needing. Make sure that your other physician is going to be inputting all those shots that you already got into your new medical record. And as you transfer medical records from provider to provider, because they're going to be moving cities, you're going to be moving jobs, whatever it is the case, take also the shot record with you.
So as the public health person, how are we El Paso, but we in America as well, of putting all these onto a mainframe to where you can always access what you have had done to you medically throughout your lifetime? And again, I know we've been talking about this for several years now, that we're trying to get to the point where it's easily, if you're in a car accident, for example, and you can't take certain types of blood or you have certain issues, how is that working again, just as a mainframe for public health? And I know we didn't practice this question before or talk about this before. I'm throwing it at you blind.
Oh, that's great.
So if you're not prepared for it, let me know. It's like, Catherine, can you please move on?
No.
But in general, how are we doing with that?
Yeah, and these are the questions that we get, especially as physicians. Like, yeah, it's gonna come, because if you're gonna work in a specific place,
Mhm.
they're gonna ask you for the shots. How am I gonna pull them out if I have it in the box somewhere?
Right.
But every state has its requirements. There's some states, like the state of Texas, that you need to sign to keep your records for a long, long, long time, especially now that we don't have the COVID public health emergency. If you don't sign that paper that says, yes, please keep my records, they're going to be forgetting about it, and the state is going to just toss them. So it is
It's up to yourself.
It's a opt-in state. So what that means is that you need to sign telling the state that you want to keep your records within the state, so whenever you need them, you can pull them out of there. New Mexico, for example, it's an opt-out state. So you're going to be in the registry as soon as you get a vaccine in that state.
So here's a question that I'm thinking of what other people might be hearing as we're talking about this. And let's say it's someone who never paid attention to this, but all of a sudden it's like, you know what? I don't know. Have I had 3 or 4? Where could they go to right now to find out what vaccines they had? Is there a record right now that they can call? And you're nodding your head, Dr. Tyrek, are you? Because if so, I'm going to throw that question right your way.
This is a major problem in the adult population.
I agree. I
We
mean,
don't-
even myself, I'm not exactly sure. So how do people access?
We don't have MTRAC. Now,
Okay.
there are some for adults.
Okay.
We don't have obligations to report to the state. So this became very fractionated when people started going to pharmacies And very few pharmacies will send their vaccine, the evidence of vaccine to the primary care physician. And so pneumonia is one of those ones that when you're meeting a new patient and you're asking, when did you get your pneumonia shot? They won't know which one they got, and they won't know when they got it.
Right.
And so it behooves the adult to maintain your own records in a file or an Excel and keep that, because physicians in the state of Texas don't have to keep your records forever. If a practice closes, and even if they stay open, they don't have to keep them after a number of years. So
May I add to that also?
Absolutely, please, Dr.
From the
Days.
pediatric, we didn't mention, she mentioned that there is an MTRAC for adults, although except for COVID, where it was actually used for adults as well. But we do have that for pediatrics in in Texas, and it's actually been very helpful.
Oh,
But,
great. Okay.
So most kids, if they have a Texas physician, if they have a Paso Physician, every time we see a patient and we give them vaccines, we input it into the IMTRAC system, which is the immunization tracking system for Texas. And so you can, if you switch physicians within El Paso, or let's say you move to Houston, they can access that. We can access it here. However, it's just for Texas. So if you got vaccines in New Mexico and you moved to Texas, we don't have those. So that part's not complete yet. So it's helpful, but it's not complete. The other thing that Dr. Tyrock brought up, which is really important now for children as well, is that a downside to what happened during COVID is that more parents started getting vaccinations at Walgreens and places like that, because now they are allowing them to go down much farther in the child. They won't do infants still, but they'll do, I think, 4 and 5-year-olds now and up, but definitely 11, 12-year-olds. And so what happens is, as she mentioned, they don't necessarily enter it into IMTRAC. And so we'll have parents who recently will come to us and say they need so-and-so for school. They need the reporting for school to register. And we don't have it.
You don't have it.
And we can't access an MTRAC because they got it at a pharmacy. And we don't have that information. And so I do think that's important for parents to understand too. It's not to say that they should never get anything at the pharmacy. It can be useful sometimes to get it there. But you definitely need to keep your own records if you do that. And you need to bring those records to your doctor so then they can then enter it in. Because we can enter in vaccines that we don't personally give as long as we have the record of what was done. Because that's also very important.
That leads me into the next question for you specifically, because we were talking about side effects and adverse effects. And I'm thinking too, with what you're saying, if there was a vaccine that needed to be had to attend a certain school, say this child already had that vaccine but doesn't remember the parent, there's no record of it, and they got the vaccine again. Are there any vaccines that are, that's not a good thing? I mean, and I'm just trying to just educate here that it's you should have more protection than less protection.
That's correct.
Maybe that's the way I'm trying to go
and
into
in general, I mean, parents ask us that all the time. In general, I can't think of a single vaccine that would harm you per se if you got a double dose of it. I mean, generally, especially if it wasn't, the same day or something, if it was a couple months later, it's fine. And as Dr. Carranza said at one point, you usually don't have to restart series of vaccines. So like the Hep B, you don't necessarily have to restart it unless you can show that you no longer have immunity to it. Then you would need to start it over. But, many people will get the first 2, let's say hepatitis B, and then they forget to get the third one. You can still get that one later. Same thing with the HPV, same thing with Hep A.
Shingrix that way? Because I only got one and then COVID hit and then all the Shingrix vaccines were gone.
I'll have to ask her because I don't give Shingrix.
A lot of people this happened too.
Then we need to talk after the show.
Exactly. But yeah, so I think generally, because we do have parents come to that, I don't remember whether they got this or they got that. So that's fine. It's probably better. You're here in my office right now. I'm going to give it to you again anyway, so that you're sure that you have it. We can show that registration to school, and you don't worry about it.
Right.
Because again, if you already, if you think about it immunologically, if you already have antibodies to that and you get another vaccine, you might have a slightly increased risk of side effects, as we say, the same way we saw with COVID. If you had the COVID disease and then you got the COVID shot, those people tended to have more side effects.
Right.
And that happens with other vaccines as well. But it's not going to hurt you per se. It's not going to cause any long-term problems.
And I love that you brought up the side effects because that's actually a good thing. And I don't know if it was our show that we talked about or Dr. Roxanne Tyrock, if you want to talk about that, but the idea that if you're getting a vaccine and your body's reacting to it, hence side effects, Dr. Carranza, talk about why that's good. If your body is reacting to a vaccine and you notice it, why is that a good thing?
Well, that is a good thing because you know that your body is reacting the way that it's supposed to be reacting. A lot of the people don't want to get the vaccine because they said, I felt so bad. I felt terrible. No more.
Yeah.
No,
But it's good because it shows your
it's
body's working.
I know. And I tell them,
Yeah.
it's like, look, it's better to have a night of chills than a whole 2 weeks of in the hospital.
Mm-hmm.
So, and Dr. Days brought a very important subject that we hear over and over. Why are we going to overwhelm our body with something? It's like, no, we don't. We go to a child's party, and there's a lot more bacteria and viruses there than what we give in the vaccines. And we
Right.
have a lot of comparisons and a lot of analogies that are going to help us understand a little bit better, because the human body is so amazing in the way that it's going to react. And what we're doing with the vaccines is that we're training that body to fight. We're training the body to recognize what we don't need in our body. And that's the way that it's going to be reacting when it finds a fully strong virus and it's not going to cause a disease. So a little bit of reaction is good. Is something that we expect, but don't be afraid of that.
So Dr. Tyrox here, like madly nodding her head up and down, because I know when I see that, it's like there's reaction in there. So talk a little bit more about that, because I feel like you want to add a little bit more on that. Or are there some vaccines that you're going to have more of a reaction than others? Maybe we can talk about that as well, and what to expect, and knowing that when you do have a side effect, this is normal, and if not just normal, good. What are some that you would be able to bring up?
Well, thank you for asking that. Did you have that local reaction to the Shingrix? Because
I did.
That is
but I expected
extremely
it.
common.
Yeah, I expected
Good.
it. So to me, it was not a problem at all. I thought, okay, this is, and to me, again, in my head, it's working. Something's going on there. My body's reacting to it. It's working. And that's the way I interpret that.
Great. And that is a great way to look at it. Sometimes when I hear somebody say, I didn't feel a thing at all, I felt completely normal, I'm almost a little worried, like, was there something wrong with that batch, or was it outside of the fridge too long, or at Walgreens, or so anyway, it is good to have a little bit of a reaction. Sometimes people will go online and they'll read about all the potential side effects.
Oh, that's scary.
The one that people dread the most is Guillain-Barré syndrome. If you look at the statistics, there is a very low risk of this. And for many vaccines, it's the very first time you get it is when you have the highest risk. For example, with the Shingrix. And then subsequent doses, the risk of that is lower. So please don't be afraid to get your adult vaccinations because of the fear of side effects or potential bad outcome.
Mm-hmm. And I'd like to add to that also that that we see that a lot in pediatrics as well. And parents will come in and say, well, I'm not going to get my child this vaccine because they had a bad reaction last time. And I said, well, tell me exactly what the reaction was. And sometimes they'll say, oh, they had a really high fever, or they had a headache all the next day, or whatever. And I say, well, you know what? That's not a bad reaction. That shows that your immune system is reacting, because if you think about the actual disease, you would get a fever, you would get this, you would get that, right? So your body is reacting the same. If it's reacting the same way as it would with the natural infection, but you're only doing it for 24 hours,
so your body's
you're not
training.
dying, you're not ending up at the hospital, it's training, right?
Mm-hmm.
And so I spend a lot of time doing prevention with pediatrics in terms of telling the parents that what to expect. Your child will get a fever today. Expect a fever.
Mm-hmm.
You don't have to necessarily treat the fever if they're not uncomfortable and they're fine, but expect the fever.
Mm-hmm.
Expect that tetanus, they're going to have a sore arm. Expect that HIV, they're going to feel a little dizzy. There are various side effects we know that happen, but that are part of your immune system reacting to that and creating that immunity, creating those antibodies. And
exactly.
And I like to think, I tell some of the little kids, like, think about, the vaccine as, somebody in your house that's looking out the window, and the disease or is the burglar.
Right.
And, when you give a vaccine, you're sending this burglar into the house and he's got a red shirt. And so you're reacting to the red shirt. And so the next time, anytime you see a red shirt,
you're going to be like, hey,
to fight against it, right? So that's the immune system, and that's what we're doing, I think. So.
Pediatricians are so much fun to have on the program, because it's like, explain it to me like I'm 10. And then you always get it, like, oh, I get it. That's fantastic.
Right. And then the flu likes to change his shirt every time. But
it does, right? And COVID for a while too was changing his shirt and shorts and pants and everything else for a while. I'd like to, so there's a varicella vaccine. I'm not familiar with that, but I'd love for you to talk about what that is, if you don't mind.
Sure. So the varicella vaccine is also one of the sort of overall relatively new ones. I mean, when I was younger, it didn't exist either. And I think probably maybe sometime when I was in my residency, it started. So I don't know, late 1990s, maybe early 2000s. I don't remember when it first came into effect, but not that long. And that's against chickenpox. And most, again, parents will say, well, why do the kids need that? Well, you got chickenpox and we were fine. And for the most part, that's true. Most people who got the chickenpox got it naturally. It was a mild infection. They were fine. But certain amount of people know it was a really bad disease. It can cause encephalitis, it can cause pneumonia, it can cause a lot of other really, really bad effects, especially if you're have other diseases. So if you're immunocompromised because of a cancer or some other autoimmune problem, you're not going to react normally to chickenpox.
Right.
And so after a while, they decided that would be a very good routine vaccine to give to kids to prevent them from getting that. And it's done extremely well in terms of long-term protection. So
good.
It is a live virus. We didn't talk about types of vaccine viruses.
Oh gosh, that's a whole nother show. Yeah, and that's
it's a
always so
live
interesting
vaccine
to me.
virus.
Yeah.
So it causes more and better lifelong immunity than
So live viruses are, in the end of the day, are better. To get.
Correct, because
Okay.
they mimic the natural immunity
Right.
more. They mimic the natural virus more, right? So varicella, they initially had only one. I think it initially came out with just the 1-year-old one. I think that was the first one that came out.
Okay.
And then they realized it did need a booster. So now there's one at 4 years old as well. So you usually
Okay.
get one at 1 year, and then you get one on entry to school. But after that, it's pretty much lifelong. I mean, most people
That's
now,
impressive.
I don't,
Yeah.
it has some bearing on getting shingles as an adult. But whether you have the live infection or whether you have a vaccine, you might still get shingles. That's why
Right.
there's the shingles vaccine separately. But it's been amazing. I mean, I did see a couple cases of chickenpox, live wild chickenpox I want to say about 12 years ago, but none of the kids were vaccinated.
Here in town?
Here in town. None of the kids were vaccinated. All of them went to the same birthday party, separate families, and they all got chickenpox, which is what we used to do.
Oh my goodness.
50 years ago, everyone would go
Okay.
to chickenpox parties. And all
It's a
these kids,
super spreader.
yeah, very super spreader. And most of them were fine, but they're really sick. And the parents had no idea what it was because they'd never seen chickenpox before. So that's what we see now. That's what we want to see. We want parents to come and say, I've never seen this before.
Right.
Or how come my kid has never gotten chickenpox? You know
Right.
why? Because they got the vaccine. And that is
such a
correct.
beautiful,
That's what we
again,
want
this
to
is the
happen.
prevention
Right,
show,
yeah.
right? We have about 5 minutes left. And Dr. Ocaranza, I would love to quickly go back. We were talking earlier before the show of when was the first vaccine. I think you looked it up, right?
Yeah.
And I think it said 1796. But I love the story around Dr. Jenner and, how it came to be. It's like, is there a way to defend ourselves? So talk about the first vaccine and how it came to be.
Yeah, it was so interesting because when Dr. Jenner was around 1700s, and at that time smallpox was just killing whole towns, and they didn't know how they're going to be able to protect. But one observation that he did was that dairy farmers were being spared from all these deadly disease from smallpox, and he's like, why? And he saw that cowpox was one of those that the dairy farmers were getting infected, and they were therefore protected against the smallpox when all these epidemics would happen. So he did an experiment and got the cowpox from one of the dairy ladies,
Cowpox. I can't even, that's just one of those,
Cowpox.
right?
cousin of the smallpox, cousin of the monkeypox that a lot of people heard.
Right.
So, and inoculated an 8-year-old, 9-year-old kid and saw that the kid was protected against the smallpox. And that's what they attributed that he's the father of the vaccination or the vaccine. And after that, he came Louis Pasteur with some of those. And we remember the Salk vaccine against polio. And how many of the older people, older too, I know, but great-grandparents used to remember that out of the whole block of kids, some of them got infected with the polio and never walked again. We don't see that anymore. And Dr. Day's touching that, Dr. Tyrek, that because we don't see it, people tend to forget that we don't have
And
those
that's
diseases.
a global effort. I mean, the Rotary clubs all
Yes.
around the world, that was the global effort. And it's amazing what public health can do when you have like everyone's heads and hearts involved in all of this.
Exactly. And it involved a lot of man hours, a lot of us vaccinating people. So we don't see those diseases anymore. So that is the beauty of the vaccines. That's what we're defending against. And that's why we can talk shows and shows and shows about what the benefits, and everybody needs to see their own risk and how we're battling that risk with something that is more of a protection, a prevention that we're trying to do. So like Dr. Jenner started and made that observation. Now we're seeing that observation that we don't have polio, we don't have measles, we don't have Haemophilus influenza type B meningitis. We used to have these children less than 6 months of age, and as soon as they get fever, we had to get the fluid out of their backs because we were so afraid that these kids were going to get meningitis, and some of them died. Some of them came with disability. So we're trying to prevent that. We're trying to cause a good and not a harm.
Exactly. And again, the title of the program speaks exactly to that. Vaccines defend what matters. On that note, though, we have to wrap up. It happens so quickly, right, the show. But I do want to say to anyone who is listening and watching right now, if you have a question specifically about vaccines, we won't be able to tackle them in this program, but we can open up the next program with the questions that you have, or the County Medical Society can get back to you. So if you do have a question, email it to info@EPCMS. Just think of the acronym of El Paso County Medical Society.
It's always a hot topic.
So EPCMS.com. So info@EPCMS.com. And also, if there are questions about shows that we've done in the past that for some reason weren't answers, we have an army of doctors. Dr. Hendricks was talking about that might be able to help out and answer those questions. So that's always a good thing to do. And if you only caught part of this program, there's a couple places that you can catch it again. You can go to www.pbselpaso.org and just go to their programming. We're the local program on there. Just look for the El Paso Physician. And then again, you can go to the El Paso County Medical Society, which is epcms.com. And then also, if you're a YouTuber, this program and I say this program, but really all the programs that we have that are able to be archived are on those platforms. And that would be youtube.com, and then type in the El Paso Physician. The word "the" has to be in front of it. And then this show will pop up, as well as other shows in the past that you all have been on. So this is a special show on vaccines, and I can't wait to see what's next. And I thank all of you guys for being here. Again, we've had Dr. Joel Hendricks, Dr. Allison Days, Dr. Roxanne Tyrock, and Dr. Hector Octaranza. Can you tell I'm doing this really fast? I'm Catherine Berg, and we have to wrap up. You've been watching the El Paso Physician.